Hello everyone, I'm back. And so these test questions are on anxiety, phobias, and OCD. So this first question is on anxiety, specifically phobias. Phobias are a type of anxiety that people have. Okay, so question number 1. A nursing instructor is teaching about specific phobias. Which student statement indicates that learning has occurred? And this statement, which student statement indicates that learning has occurred, is going to be, you're trying to pick out the right answer, basically, in this question. So, answer choice number 1. These clients do not recognize that their fear is excessive and they rarely seek treatment. Number 2, these clients have overwhelming symptoms of panic when exposed to the phobic stimulus. Number 3, these clients experience symptoms that mirror a cerebral vascular accident, or CVA. And number 4, these clients experience the symptoms of tachycardia, dysphagia, and diaphoresis. Okay, so I'll give you a second to think about what you might think the answer is. You can pause the video. And I'm going to take this opportunity to ask, please, if you are enjoying this content, if you're getting something out of it, to please like and share my videos. I will be adding these to all of my social media platforms, and if you'll please subscribe, that would really help. And any comments you have are welcome, and I will certainly reply to your comments and questions. Okay, so on this one, number 2 is correct, the correct answer. These clients have overwhelming symptoms of panic when exposed to the phobic stimulus. Okay, they are going to have a panic anxiety or panic attack when they're exposed to the phobic stimulus. Okay, and number 1 is incorrect. Clients do often seek treatment for these disorders. Number 3 is incorrect. These clients are not going to have symptoms similar to a CVA when they're having anxiety attacks from phobias. Number 4 is incorrect. These clients experience symptoms of tachycardia, dysphagia, and diaphoresis. Specific phobias. This is the clients are not necessarily having symptoms of tachycardia. Dysphagia and diaphoresis, okay? Tachycardia is a fast heart rate. Dysphagia is difficulty swallowing, and diaphoresis is excessive sweating. Okay, the number 4 answer choice, they may have tachycardia and diaphoresis, but they're not going to have difficulty swallowing. So you have to look at all answer choices in every answer choice. Within that number 4 answer choice, there's 3 things. So all those 3 things have to be true, and they're not. Okay, so that's why number 4 is incorrect. Next one is also on phobias. A client has a history of excessive fear of water. Which term should the nurse use to describe this specific phobia, and under what subtype is this phobia identified? Okay, and I'll give you a moment. Aquaphobia is number 1. The letter A, aquaphobia, a natural environment type of phobia. B is aquaphobia, a situational type of phobia. Letter C, acrophobia, a natural environment type of phobia. Letter D, acrophobia, a situational type of phobia. Okay, so the correct answer is letter A. Aquaphobia is a natural environment type of phobia. Natural environment. Phobias are fears about objects or situations that occur in the natural environment, such as heights, fear of heights or storms. Number 2 is incorrect because the aquaphobia is a natural environment type of phobia, not a situational type of phobia. Number 3 is incorrect, okay, because acrophobia is an excessive fear of heights, and that's a natural type. And same reason why number 4 is incorrect. Acrophobia is a natural environment type. Okay, so this fear of water is aquaphobia, which is a natural type of phobia. All right, on to the next one. Okay, this one is on OCD. OCD is abbreviation for obsessive compulsive disorder. Obsessive compulsive disorder. Let's break down those words. Obsessive or obsessions are ruminations, obsessive thoughts, unwanted, intrusive, repetitive thoughts. The compulsive part of the OCD are the compulsions. Those are the hand washing, door checking, stove. You're checking the stove. You're thinking the stove was left on. Things like that. Those are compulsions. Those are the differences between those terms. Okay, client diagnosed with OCD reports to the nurse that he can't stop thinking about all the potentially life-threatening germs in the environment, which is the most accurate way for the nurse to document this symptom. Okay, so number 1 is client is expressing an obsession with germs. Number 2, client is manifesting compulsive thinking. Number 3, client is expressing delusional thinking about germs. Or number 4, client is manifesting arachnophobia of germs. And I'll give you a minute to think about the question and come up with what you think might be the answer. Okay. Okay, so in this one, number 1 is the correct answer. In this case, a person can't stop thinking, keyword thinking, about germs. Okay, so the thinking part is the obsessive part. Thinking, obsessing. So the client is expressing an obsession with germs. They're having those unwanted, intrusive, repetitive thoughts that I talked about. Ruminations, they're called. Ruminations. Number 2 is incorrect. Compulsive thinking. The compulsions are different from the thinking. Right? We have obsessions and then compulsions. So the compulsions are the patterns or behaviors, the hand washing. Think about hand washing, especially with germs. Number 3 is incorrect. Delusions are false fixed beliefs, and I'll cover delusions on another slide or another video. Someone having delusions is someone who is suffering from something like schizophrenia. And number 4 is also incorrect because arachnophobia is the fear of spiders.